Welcome back to the exhibit hall at Eyes on Dry Eye 2023. I'm your co-moderator, Dr. Damon Durker, Director of Optometric Services here at Eye Surgeons of Indiana. This next session is Get to Know BioTissue, and I'm joined by my friend and colleague, Roger Kennedy. Roger Kennedy is Director of Marketing, Ocular Biologics at BioTissue. Roger, welcome to Eyes on Dry Eye. How are you enjoying the show so far?
Thanks, Dr. Durker. I appreciate it. I'm enjoying it a lot. This is, I think, my third year attending the program. It's always so much information. You guys have really done a great job with the content, the speakers. I've been on since the very beginning, so I'm enjoying it.
Fantastic. So we're going to be talking about BioTissue. It's a big part of what I do in my practice every day in treating patients with ocular surface disease, particularly with Procare. But there's a story that goes back a couple decades that I think is really interesting with BioTissue. So tell me, Roger, who is BioTissue?
Yeah, thanks for the question. BioTissue, one of the reasons why I love working at BioTissue is kind of the story behind it. When you look at BioTissue, it started off with Dr. Sheffer Sang, which a lot of people know, and his wife, Amy Sang. But what a lot of people don't know is how it started is Amy Sang was working at a top 4 CPA firm in a very progressed career, successful career. Dr. Sang was a researcher, an ophthalmologist, eventually chair at Bascom Palmer. Dr. Sang really started doing more and more research on limbal stem cells, on amniotic tissue, birth tissue, and all of the effects of it. And they both decided to quit their jobs and start a research company because of the belief and kind of the power of what they've seen. Throughout the course of 20 plus years, they've realized certain aspects of the product, what's the key biologic in the product, started to commercialize the product, did a lot of background work as far as securing a level 1 CPT code, getting FDA designations. And now today we're over 200 employees. We have 600 applications, over 300 peer-reviewed studies. It's really a success story, and really their goal and our goal at BioTissue is to help realize the full potential of regenerative therapy, and we're doing that by obviously exploiting all of the effects of amniotic membrane, umbilical cord, not only in the eye but outside of the eye as well. There's a company outside of BioTissue, Ocular. It's BioTissue Surgical, but it basically goes over everything outside of the eye. We're in spaces such as orthopedics, diabetics, urology, trauma, just a whole host of indications that we're learning that this same technology can be used for and is successful to treat.
That's a lot of passion from Dr. Sheffer Sang and Amy Sang going back a couple decades to realize the potential with everything that Procare and BioTissue have developed that have been so helpful to our patients. So there's a lot of different disease states that your products can help with. What are the most common things that we're going to treat that BioTissue has a solution for?
Yeah, I mean, when you ask the question, I think of what don't we treat? We have the good fortune of being able to treat a number of indications. Probably the most notably, right, with this program, Eyes on Dry Eye, moderate to severe dry eye disease, we've had extreme success in. I would think that's probably our most popular indication on the ocular side, but it's not limited there. On the in-office Procare, we treat everything from moderate to severe dry eye to non-healing defects, whether it's epithelium related or basement membrane related, corneal ulcers, herpetic keratitis, graft versus host disease. We have a whole range on the in-office side of it. And on the surgical side of it, pterygium surgery, we just finished, Dr. Desai just published the largest pterygium study done, showing an extremely low reoccurrence rate, the lowest reoccurrence rate for a pterygium study using our product. We're effective in CCH, I know, which has been mentioned a couple of times throughout the program as well, a surgical intervention for CCH using our graft. Oculoplastics has really come on board as well, using our AmnioGuard product, our umbilical cord product, basically as any type of substitute that you're looking for an allograft. You can have a biologic allograft basically with umbilical cord in our AmnioGuard product. So really, there's a whole host of indications that we're used for.
Yeah, certainly my clinic in Indiana, we are treating the corneal sequela of dry eye as the most common reason, and we'll use both the Procare Slim and the Procare Clear to treat that. When we're looking at that, it's really patients with SPK that's not getting better with, lubricants and topical steroids in particular, immunomodulatory drugs, filamentary keratitis. But I also think more and more we understand that the more end-stage disease or the progressive dry eye patients actually end up with neurotrophic keratitis. Yeah. So that's probably the biggest area of growth in the last year or two in my clinic, is treating neurotrophic keratitis patients, even at the earliest stage, stage 1, where it's just SPK that won't go away, using Procare line of products for those patients. Are you seeing that as kind of a trend in other parts of the country as well?
Oh, absolutely. And to be honest, it's not just us. The AAO via iWiki has kind of posted, as everybody knows, right, the Mackey scale for neurotrophic keratitis on stage 1, and I know it's discussed on this program, right, could be found as early as SPK. AAO has kind of posted some stage 1 level treatments, including Procare specifically on the treatment. So yeah, I know it's been referred to a number of times for a number of years, but with the definition of dry disease changing to include neurosensory abnormalities, and us learning more and more that nerves are integral in dry disease as we continue to learn about it. I think similar to kind of MGD, right? The more you're looking for it, the more you're finding it, especially amongst those SPK patients. So we're really trying to encourage everybody, especially your dry patients, especially at the SPK stage, to at least do corneal sensitivity testing. At the very least, I think you're going to find, at least we're finding in our experience with our customers, that quite often, and more often than not, that they do have some level of reduced sensitivity in the cornea, and then to treat appropriately, obviously. But one of those treatments, as recommended, like I said, by AAO, is Procare, and we have some studies to suggest, right, that we're effective increasing corneal nerve density and sensitivity. I know there's some other products there that help with that as well, but you're also getting the benefits of cleaning up the ocular surface, controlling inflammation, preventing any type of scarring. So there's a whole host of reasons why Procare makes a lot of sense for neurotrophic keratitis.
Yeah, so I think about those patients that have dry eye disease and keratoconjunctivitis sicca, and I was treating them with Procare in the past, but I was probably just not labeling them NK. A lot of them have reduced corneal sensitivity when we test for it, and we know that that's going to improve when we use a proper treatment like a Procare for them. So that's something that's the big trend in Indiana, I think, is looking at those patients and getting that diagnosis nailed down. So Roger, looking at the space for ocular surface disease treatment, what makes your product line different than other competitors?
Yeah, so what I would say is everything that BioTissue does in regards to, so we're specifically dealing with birth tissue at BioTissue, and everything that we're trying to do is based off the research with our founder, right, Dr. Sang. And so the reason why he left his chair at Bascom Palmer position is because of kind of the research he's done on how incredible fresh amniotic membrane and the properties behind that are, right? It causes this thing called fetal healing, where in the fetus, healing tends to be a little bit more, for lack of a better word, efficient. You can actually heal where the primary function, the priority, right, is for development. So things like inflammation, things like scarring, are controlled in a lot better way because of the development aspect. Where us as adults, when we have any type of assault, right, our primary function is protection. So we immediately have inflammation, right, the inflammatory cascade. So it's a different way of healing, and so we want to try to bring, and that's what amniotic transplantation is, right, is bringing that fetal healing to the adult environment. One of the key ways that's done is the retainment of a key biologic. The reason why amniotic membrane is so in therapeutic properties is because of a complex that we've isolated. It took Dr. Sang, I should say, I'm not going to take credit for it. Took him about 10 years to realize that it was HHA PTX3. So our product is cryopreserved, and for the sole reason of retaining that HHA PTX3, we've proven that we retain that molecule with that. Outside of that, we have The only amniotic membrane product that's FDA with an FDA designation of anti-inflammation, anti-scarring. It's FDA cleared. Only amniotic membrane product with a 510(k). And outside of that, we all know, right, there's a plethora of options for treating things like ocular surface disease, all of which are appropriate at different times. For us, I think a nice value proposition, if you will, is you're going to get a product that's fast acting. We have a whole host of studies that show effectiveness in reducing signs and symptoms in as little as 3 to 5 days. We see that reduction in signs and symptoms last as long as 3 to 9 months. And it's for the most part reimbursed by most commercial payers. So really, really good option as far as a practice growth, as far as doing the right thing and being clinically effective for your patients, and hopefully alleviating some of the financial burden from a patient where ocular surface disease can be expensive, right? For a lot of these products that may be cash pay or some sort of medication for a long time.
And you said 3 to 5 days, and I think that's kind of where I was at the last 5, 6 years. And the last couple years, based on what I'm seeing and talking with colleagues and even looking at the literature a little bit, for some of these patients that have corneal sequelae dry eye, 2 or 3 days actually does a really nice job for these patients. So it becomes a little bit easier for me. We'll put in a Procare on a Monday, take it out on a Thursday, and it's not a whole week-long process. I think we're understanding what that can do in a shorter period of time. So that's been the other trend, is NK, making that diagnosis. And then for the dry eye disease patients in particular, maybe 2-3 days, and we have a nice therapeutic outcome. Have you seen that in other places as well?
We have, yeah, we're seeing that more and more. We host a meeting about 3 to 4 times a year where we bring in specialties from both the ocular side of things and outside of the eye, right? Our surgical division. And in a number of those meetings, we've been seeing exactly what you're saying, anywhere from I've heard as little as 24 hours to 3 days to 5 days. Really, for the amniotic membrane to be successful or to be effective, it really depends on how inflamed the eye is, right? How hot the eye is as far as absorption. If you're looking at some sort of SPK, whether it's NK, whether it's neurotrophic or not, you can see effectiveness in as little as 2 to 4 days. For something like a corneal ulcer or a chemical burn, things like that, it's probably going to be a little bit longer. But we are seeing more and more folks putting it in and having effectiveness with their patients in about the 2-day range, plus or minus a day or two.
Yeah, and for those patients that have hotter eyes, sometimes we do need to use more than one Procare, especially if you're dealing with the infectious ulcer. We've kind of isolated what's going on. We want to prevent scarring. Sometimes they'll need a couple Procare. That's not unusual in our clinic. So a lot of different solutions that you have for a wide spectrum of ocular surface disease, both in the office and in the surgery center. But what can you tell us about the pipeline? What other things are coming from BioTissue?
Yeah, so for us, we are a bird tissue company. So everything that we do, and when we look into the future, it's going to be leveraging that platform technology. We already have an accepted IND for a gel formulation for our amniotic membrane. We're going to be starting clinical trials actually this year, the back half of this year. So that, I think immediately that is going to be our focus on the ocular side, is getting some sort of gel formulation. We feel really strongly about our position in kind of that when it comes to ocular surface disease in that moderate to severe state. And now when we're looking to the future, whether it's product development for something like a gel or partnering via business development with other companies, we're looking to get more on that spectrum of the milds, really kind of taking ownership of that continuum of care where we can help patients from a mild state to a severe state with that same technology, obviously having appropriate platforms for each of them. And then on the outside of the eye space, it's a lot more exciting, but we have a ton. We have 2 more INDs, a couple of which are in the phase 3 trials. Things like diabetic foot ulcers, knee osteoarthritis, things outside of that. And I mentioned that only because it's using the same exact technology that Procare and that AmnioGraft and AmnioGuard has. It's that same platform technology and same kind of similar endpoints, showing that you need to decrease a wound, you need to control inflammation, you need to prevent scarring, and we're seeing extreme effectiveness in kind of these extreme cases. And we hope to see the same in our gel formulation in moderate cases.
So is the early data showing that if you're in a gel, you guys are the only cryopreserved product out there, does it retain the same biologic properties as it is if it's on a ring or if it's on tissue, if it's in a gel?
Yes, yeah. So it'd be the same exact biologic properties. Once again, for us, our primary focus, everything that we're going to be doing is focusing on retaining that fetal healing simulation, right? That fetal healing environment. So whatever we do, we want to isolate and retain that HHA PTX3. We want to do it in hopefully different formulations. I think I saw some questions here as far as gel or drop. I think that's the part that we're trying to narrow down, is whether or not we want it to be self-patient administered or have it be a medical device. Those are questions that are we're on our final stages of determining. There's pros and cons to both of them. But to answer your question, it is going to be the same exact properties that are going to be retained. It's just a different platform or different mode of delivery.
No, that sounds great. So if somebody wants to know more about your products, get more information, what's the best thing to do to learn more about BioTissue?
Yeah, so I think that probably the best, and I think a lot of my colleagues agree with this, probably the best way to learn more about, I think, products in general is peer-to-peer interactions. We've really taken focus since COVID probably to invest in our professional education platform and opportunities and events. We have over 200 plus professional education events, things like the summit, which I spoke to you about, which is bringing multiple specialties, local speaker programs. We have 360 visits where people come in-house. So, what I would advise is it could be as simple as going to our website, www.biotissue.com. I'm going to be on the chat here for the rest of the time. So you can kind of shoot me a note, as well as my colleague, Rachel. She'll be there as well. Reach out to your local rep. We have 55 direct sales reps that are filled with knowledge. And they can hopefully, right, and they will direct you in one of those professional education programs where I think it's ideal for everyone to learn about the product. And amongst that professional education experience, Dr. Sang is heavily involved in that as well. So if you want to hear kind of directly from the person who pioneered the birth tissue industry and nuggets and questions and things like that, he's always available as well.
Yeah, I think you guys have done a great job. I've been there consuming that information. As a practitioner, I've had the opportunity to lead some of those sessions, and I think your company is doing a great job to help with peer-to-peer education, which is so critical. And of course, thank you so much for supporting this event. It's really been a great conversation. I've got one raffle code before I actually have Roger have some final thoughts here. I'm going to give the raffle code now. I'll put it in the chat too. It's keratoconjunctivitis. I'm going to probably have to type that one out. Keratoconjunctivitis. But Roger, I know we're going to get back to the rest of the show. Final words about ocular surface disease and the solutions that BioTissue brings to the table.
Yeah, I'll just speak from somebody in industry and kind of observing, right, and in marketing, right, kind of observing the trends. I think there's no better place to be, or no position to be, no space better to be than the position that we're in right now. Ocular surface disease, we're learning, is so pervasive, so prevalent, so complex, right? And there's so many different ways to treat it. And when you even look at the definition of dry disease from 2007 to 2017, we've seen so many changes. So who knows what it's going to be 5 years from now, 10 years from now. So just a really exciting space. Happy to be working with a company that helps provide that. There's obviously a number of options, and we thank you guys and all of our customers for considering us as one of those options.
Thank you, Roger. Roger Kennedy, BioTissue. Great conversation. And I will see you a little bit on the exhibit hall track.